It's kind of fitting that I would be at the end of the program because the water industry in this subject is sort of at the end of the program. You know, people take the drugs and then it goes into the wastewater and then it goes into our streams and then we pick it up in our intakes and then attempt to treat it. At this point in time, the stage at which we're at or what we've done in the past has been mainly to support agencies such as yourself who are out there doing some of the preliminary research. We partner with universities and colleges of all kinds. American Water has water plants and wastewater plants all across the country and of all different sizes, different types of treatments, different sources. And we partner, like I said, all over the country with many different types of universities to try to get some of this research done to identify possible contaminants in our influent water, and so that we know whether or not there is potential for our water being contaminated and for our not putting out the kind of quality of water and safe water for our customers. So that has mostly been, today, what our role has been to support. We also supply monetarily to AWRF, the American Water Works Association Research Foundation, has been mentioned many times, and has sponsored several research projects in this area. The only other thing I think that we've pretty much done to date is to try to educate our consumers in things such as not flushing pharmaceuticals down the toilets and such, and proper ways of disposing of them so that they don't get into the water to begin with. Now, our hopes for the future depend a lot on you all. Our first priority would be that someone would come up with an approved, generally accepted methodology for testing for each of these compounds. If that would happen, then we would hope that we have a laboratory, a national laboratory in Belleville, Illinois, and we would hope to be able to gear up and put the money into training someone to beginning to, whatever that methodology is, beginning to do that, to test all of our facilities across the country and find out in much better detail just what is out there, what is getting in our plants at this point in time. One reason why we hesitate, we've been thinking about this for years, but one reason why we hesitate in doing that right now is because the goal in our company is of course foremost the safety and health of our consumers, but also we have to watch their wallets. And we have to justify everything that we do. So we try to partnership where we can, especially in these preliminary type research, to limit the cost to us. If and when a certified methodology is obtained and we can go to all of our plants and test them in both the raw and the effluent, that testing will help us not only know what is there and if it's worth our trouble looking into it further, but it also will tell us in the existing type processes which we have, which ones are working, which ones aren't. Most of our processes right now are carbon absorption, oxidative type processes because we disinfect the water, and some membrane technology. But we'd be very interested, of course, in partnering with groups such as Tim's group that are thinking of other technologies that might be practical and useful for doing that kind of thing. So that would be something that we could do in the future, and we're very much interested in doing, is partnering with and another thing we have always done and will continue to do is we can supply samples. I sometimes tease about how we supply more water to agencies for research from our plants than we do to our customers, because it seems like we're always shipping out samples to everyone. So, and we're quite happy to do that. It takes time, but we do have the personnel in our plants who are trained and skilled at doing the proper sampling. Sampling is sometimes everything when you're trying to do a research project. And so we're very happy to play that role, even though it does take a lot of time on the part of our employees, and of course that's money too. But we realize the importance of it, and so we do quite a bit of that. But the next step after we would determine what is in there and what our current methods of treatment are doing is, of course, to try to do some pilot studies again, partnering with maybe some of the people in the universities and colleges who are developing new technologies, do some pilot studies in all of our plants, in the ones really that we have seen have problems in terms of chemicals coming into the influent. Now, another priority to us would be to determine the toxicological levels of each of these chemicals, because then that would help us to prioritize which plants we're going to start doing these pilot studies on, and also the necessity of doing it. And then after that, what we would do is, if we find some good treatments, then we would have our engineers would begin to try to start to put those treatments into our plants so that we can reduce those amounts of chemicals. Basically, again, our main approach right now is we have to balance out both the health of our customers and the impact to their wallets, the health of their wallets. So that's where we are right now. Mainly in the past, we have been, to sum it up, we've been helping other organizations that are trying to do the research sampling, and hope in the future, near future, if there's a methodology that's established, that we can begin to do our own sampling, our plants, our own pilot testing, and our own installing of new treatments. So.